Hey, good morning, everybody. Welcome to another Compliance Capers. My name is Sonal Patel with SP Collaborative, and this is my good friend, Betty Hovey with CHCS Consulting. Hi, my
Hey,
friend. How
y'all.
are you?
Good, good. How you doing?
Absolutely fantastic. It is the month of June, right?
Yay.
Finally, we are in a brand new month and a brand new month for our Compliance Capers topic. And we wanted to reveal to our audience today that we're going to be spending the entire month, each and every Friday in June, on the Targeted Probe and Educate program, those TPEs, right? I can't wait.
Yep. This will be another good month of diving into something. I think this is a good one for practices and people to kind of be more aware of what's out there.
Yeah, absolutely. Absolutely right. We've been focusing a lot on, of course, compliance that's been issued from the CMS, from the various payers, et cetera, in our previous compliance capers. But we know we really wanted to spend this month on something new, something different, and that is the TPE program. And, I know we've been on a little bit of hiatus for some time, especially since the pandemic ended. The program was kind of at a halt for quite some time during the pandemic, and TPEs stopped as well, again, because CMS, the max, everybody was kind of sent home to do their work, right? And
Yep.
so the entire TPE program hit pause as well. But as of August 2021, that was lifted. And so we saw this flood of TPEs being issued once again. And I know here in 2024, they've ramped up, and we'll talk about that later in the month, definitely. But for today's episode, we really wanted to, talk to our audience about the background details, the rich nuances that are involved in the TPE process.
Yes. Yeah. We were discussing too when we're trying to choose like what our subjects are going to be. We kind of list out our idea stream and then figure what could be good to talk about. And the TPEs, I think, are another good thing to hit because they've been around for a little while. It's not one of those programs that's like decades and decades, but they piloted it first, and then kind of moved into success. And you had some information on the pilot program because it wasn't the all-encompassing program it is now. When they piloted it, they
That's
were
right.
looking at a smaller universe of things, right?
That's absolutely correct. So back in 2015, this is a fun fact for the audience. It started out as a trial for only two healthcare spaces in the inpatient admit space as well as home healthcare. But because that pilot program was so successful, CMS and all of the MACs embraced it. And so, really, all of our providers in Part A and Part B, multiple service lines are now included as of 2017. So again, these types of programs are developed by the CMS to protect the Medicare Trust Fund, right? That is the overarching why, the rationale behind why the TPE program exists. It's to protect those vulnerable funds that are there. So our providers, our practitioners need to keep that in mind. When and if you ever do receive a TPE notice, and then the subsequent pieces of mailings that come to you during the TPE audit process, that is the greater rationale, the why. They really want to make sure that you have coding compliance, documentation compliance front and center at your practice for the multiple service lines that you do provide there. But yeah, I thought that was a really interesting fun fact that it is a relatively new thing.
Mm-hmm.
And they do combine it with the arms of education, as well as, if you don't fix it in these multiple rounds that they issue to you, the TPE audit process does have that final right to, kick you over to the recovery auditors. So if you
Yeah.
can't clean up your act within these multiple rounds, as we'll talk about here today for the background, they do have that authority to kick you over to those RAC auditors. Yeah.
Yeah, yeah, and this is a program that is not going away. When they did the first like full fiscal year program from October of 2018 to September of 2019, they found a 40% error rate overall. So anytime they pilot something or take a look at something and they get an error rate that's like that, it's not something that you're going to see as a fleeting program. So they looked at almost a half a million claims, 435,000 of them. And they reviewed 13,500, I believe it was, providers. It was over 13,000 providers that were included in it. So with that 40% kind of error rate, again, some are for like little things like that's missing a signature, or it's missing a date, or it's missing, they're not always only about coding issues specifically, like your leveling or anything like that. There's like a whole myriad of things that they'll look at. But yeah, 40% error rate. I mean, that's anytime you see that, it's here to stay, So it's
That's right. Yeah. Those numbers are huge.
So they'll be
Oh,
quiet.
they're saying hello. They're saying hello to whoever's outside. That's right.
My fur babies are saying hey.
Yeah, but no, that's an excellent point that, when those error rates are so high, these types of programs are therefore warranted, right? That just makes them dig their heels in more, that, they want to turn that percentage to, much, much lower, much lower.
Yeah.
Yeah, for sure. For sure. So why don't I go ahead and find our first link here for the audience on the background details from CMS that they can peruse at their leisure. But this is really where, CMS is going to be talking about the greater background details, right, on what goes on in terms of what they're going to be issuing. And in general, I know I've had a lot of experience working with providers and practices when they do receive a actual notice of review. That piece of mailing comes first. That's kind of the first thing that alerts a practice that, hey, we've chosen you and your practice. This is your notice of review, that you will be receiving subsequent pieces of mail that will instruct you to provide us between 20 to 40 claims that we've highlighted that need additional review. So of course, the CMS has the claims on file. What they're asking for is that all-encompassing documentation. So, not only, I always like to advise, it's not only just the bare bones of the service line documentation, that note, it's all of the other supplementary documentation that could support that service line a lot better. So, as we go into the next weeks ahead here, when we talk about the various specific service lines that are at issue from the various MACs, we can touch on that more. But in general, I've had experience working with practices, and the letters that I've had to look at requested 30. So the sweet spot for the multiple things that I've had to work on and the specific service lines, those practices were asked to only send 30. So again, it's between 20 to 40. And in my experience, it was always right in the middle, the sweet spot of 30. How about you, Betty?
Yeah, well, two things. One, you made a great point for everybody to pay attention to, and that's that don't just get in your head, it's just a note. Make sure that if you're sending the documentation, it's all the separative documentation that goes with it. If you need to send orders or you need to send reports from x-rays or radiology or whatever it is, that, it's not just copy this note in here, we'll just send it off. Somebody's got to go through that stuff to make sure it's complete. But yeah, I get a range. I think 30 is usually what I've seen too. But then depending on the MAC, sometimes, and that's one of the points of the program. I mean, CMS made the program, but the MACs, each MAC, runs their program. So depending on who your MAC is, you may see variations where it's the 25. I've seen a lot of 25 too, because it seemed like, I don't know, it seemed like a nice even number of order of 100, sort of thing. But yeah, 30 is one of the ones that I'm used to seeing too, because it is that halfway. They just went with splitting the baby down the middle. But yeah, it could be anywhere between 20 and 40. So that's something else when people go to the link you put up, that they'll be able to kind of read through and see what the criteria is and what they'll ask for. So yeah. And it's interesting to go through that with a client, because it's like, I'm not an employee in the office. So when I sit in on the TPE meetings, it's kind of like from the outside, I'm kind of listening for those nuggets from the MAC when they're giving them the education to say, okay, they kind of keyed in on this one point a couple times, or they seem to emphasize this one specific thing. So then I can go back for my client then and help them a little better, to make sure they're cleaning up what they're actually looking for under the TPE from the MAC.
That's right. Yeah, you made a great point there, Betty, that all of the MACs are in charge of doing things their way, right? So I really want the audience, I really hope after all of these months with us on Compliance Capers that you heed our advice and go ahead and, bookmark your MAC for yourself, because they are providing you with a wealth of information on their various web pages, a wealth of information on what is under their direct purview for that particular month. I know my NGS up here in Illinois, highlights things from month to month. What are they looking at? What's hot? What educational webinar are they providing? When are they next talking about what they're seeing in their region for TPEs? So, I know you and I provide a lot of education to our coding and compliance professionals as well in terms of what's going on currently, right? And it's really important to look around, peruse all of the MACs and see, because in general, you and I have been doing this for long enough, the MACs will sort of go, oh, hey, Palmetto GBA is looking at this, maybe we should too, and when I put together large presentations, I do see kind of a reflection of that, is that the E&M TPE is going to trickle over to more than one MAC, because one MAC said, hey, it's time. We're seeing a lot of shenanigans here. It's time to put folks under a TPE, right? And then eventually the others will follow suit as well. But in general, that was a great point that you made, is that the MACs really are in charge of doing things for their jurisdiction, for their areas, in their own specific way. So that's a great point. Based on this link, I wanted to read to the audience, what Medicare says about the TPE program.
Sure.
This is really important because, like I hinted at earlier, it's both educational and, again, it can also kick you over. if you don't follow this education. So it says, when Medicare claims are submitted accurately, everyone benefits. CMS's Targeted Probe and Educate TPE program is designed to help providers and suppliers reduce claim denials and appeals through one-on-one help. The goal, to help you quickly improve. So I thought that I quoted that directly from their webpage. So that right there is their soft sell, in my opinion, right? It's their saying, we really are encouraging you to use us because we're there to help you improve quickly, right? And you had jumped
trying
ahead.
to make it seem less scary or less painful, maybe.
Exactly. That's their soft brush that they're painting with, right? Oh, this is going to go really, really well and really, really smoothly. But as we unfold in our conversation today, because we have experience in these TPEs, you had hinted at earlier and you jumped ahead to the nurse education. They are phenomenal, right? When you're at that point in the TPE process of actually receiving the education, in my opinion, it's really, really wonderful. It's really, really comprehensive to that service line, for that provider, for that practice. A lot of that education is stuff that you and I do all the time at that comprehensive level, on just pinpointing what could be tweaked, what is missing, right? And so I really do think that the various letters and stages that come in, I want you to please walk the audience through the multiple rounds that are involved. I want the audience to remember that they have 3 chances, right? That's the American phrase. Is it baseball, 3 strikes and you're out? Yeah, that. So it's the same thing here with the TPE program, is they give you 3 chances. It's a lot of chances, but again, they also have bells and whistles and hoops that you have to jump through as usual with their deadlines that they put upon you. So I'd love it if you could tell us a little bit more about those multiple stages.
Sure. Well, with the TPE, if you receive a notification from your MAC that says that, you've fallen into whatever criteria they're looking at, it could be that you're an outlier. It could be that they're looking for some kind of specific error that they're seeing a lot in their region, whatever the issue is, that you've magically made it onto their list. So you get that letter that lets you know you've been selected for review. So then they start what they call the targeted probe, which is you'll get those additional documentation requests in that letter. So it's an ADR, and they'll list out the patients they want, the dates of service they want. You get it all together, and it'll be that 20 to 40 records that we've already talked about, and they call that a round. So that's your first round. You send that information in, and then they will assess it, they audit it, and then they come back and set up your contact or one-on-one education. So this is not like when NGS or Palmetto or First Coast does all those webinars that everybody can go attend, and they talk about stuff. This is specific to those records you sent them. So it's their review with you of what's in those documentations that is still an error, what needs to be fixed, where that problem is that they were looking at in the first place for you. They go through, and they'll go through note by note with you. At least the ones that I've been participant in, they literally just go down the whole line of them. The ones where, there's an error. I mean, if there's nothing wrong with it, they're not going to, spend time doing that. But, so they'll give you that education, and then they leave you breathe and let you kind of ruminate over that and make your changes to your documentation. And then 45 to 65 days later, you have another round. If you showed that there were still sufficient errors that it needed to continue, so you get another ADR for another 20 to 40 records. You'd put those together. The process would go over again. So that's your second round. And if the improvement was such to where there's only like a little minimal or a minor thing, you might be done. They don't always go all 3 rounds, but if you still are having issues, then they do the whole process again for round 3 and another, after that 45 to 65 days, you'll, get another round for another 20 to 40 records and you'll do it again. So they really, kind of give you, it's not bam, 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 one after the other. And they make sure after the 45 days are up, when they ask you for records, they're not going to ask you for records from a year ago. They're going to ask you for records from that 45-day period where you were tweaking things to see. So I think that's great that they do that it's not, they're not, because otherwise, to me, they're just being more punishing if they're continuing. It's not going to do any good if I'm educating you to go look at something from a year ago because you didn't have the education then. So, the way they do it makes sense and is lined up right. But that's kind of the process, how they go through it. And I think you've got a slide, right, that kind of shows that process.
That's right, Betty.
It kind of, and this is from the from CMS's website. So that's where we pulled this from. So you can see, you get the 20 to 40 reviews. If some are denied, you'll get that one-on-one. Then they'll give you that 45 days at least. Then they'll ask you for 20 to 40 more. So you just keep in that circle for 3 rounds. And if you found to be like, all right, we're good now, we don't have to, like someone had said, we're not going to kick you over to the rack now because you're not listening to us or you're just not getting this. If you're good, then over to the right of your screen there, you see that they'll leave you alone on that issue for a year. Now that doesn't mean forever. It says for a year. So if you've been in TPE, understand that, after that year's up, they're probably going to check on that again to make sure that you haven't fallen back into old habits. So, but that kind of in a nutshell is the little slide here showing the circle of how they do it.
Exactly. That's a great breakdown that you provided for the audience, Betty. And your last point there is spot on. Our practices need to be aware that, if you can successfully pass a TPE audit, it doesn't matter if you pass it in round 1, round 2, or round 3. You passed, that's a win, in my opinion. And it's only for that one service line that your targeted probe and educate was issued for. That one service line, that will get a pass for 1 year. But like you had stressed, it's very important to remember that they're looking at everything, right? So you can receive another TPE at some point for something else, for another service that you're providing at the practice. So take that with lots of grains of salt as well. But it is a good thing that if you clean your act up for 1 year, you will not be looked at for that specific TPE that you were being looked at for those first 3 rounds. So that's also a great point to reemphasize. And I believe we have another slide that we wanted to put up and show the audience again for, what they talk about on their webpage. That link that I provided you. In general, these are really general, in my opinion, common claim errors that they see and that they identify. Now, from what I've seen through experience, there's much more involved than simply the signature of the certifying physician was not included. But in terms of their encounter notes, like lack of documentation, insufficient documentation, things like that, I've seen time and time again. Or the fact that documentation does not quite meet the medical necessity, that I've seen time and time again. But I always advise it's that supplementary information that can help support the medical necessity. And so I really always stress to providers is to shift their mind from not just sending that one note or that one op report or whatever it is for the service line, right? It's all of that other supportive information that will help drive the medical necessity. And then finally, that missing or incomplete initial certification or recertification. So those are some of their common claim errors that they publish on their website. So I wanted the audience to really keep that in mind. But how about you, Betty? What other things have you seen in your personal experience that are, common to what you have seen as an error?
Most of them are around the documentation and either the practice, sometimes not sending that complete, because a lot of times when, I don't know about you, but when I get called in, by a client that's new, like I get the queries and, oh, we got this thing from Medicare, but they didn't even understand what it was. So they got it and they just send the documentation off. They don't even, they just like, oh yeah, we just send it. And I'm like, okay. And so now they're calling them for the TPE one-on-one. Yes. That's when they contact me. And I'm like, well, why, why didn't you contact me like when you got the letter, and so when they send the information, a lot of times they don't send complete information. So I think that's some of it right off the bat. But the one that surprises me is the signature thing. I'm like, seriously, especially now with EHRs, where it's, you can electronically sign it and click and there's so many times where I'm like, I don't get it. I don't get how y'all are forgetting to sign your documents. That's kind of like, basic 101 kind of stuff. But it still comes up a lot. But yeah, usually it's the documentation, and a lot of times the separative documentation that they just forgot to send. So, that's something that when you're under the TPE and when you're in a round, you can just contact the MAC. Like in our cases, when, they called me at that point, and engaged me, and I went and looked at what they sent, and I'm like, well, y'all didn't send this and this and that. We contacted the MAC and went through the stuff that, there were some things that weren't sent initially because they really didn't understand what's happening here. And, so we want to add these things to, help support the review that's being done, to kind of put it on a better path to where their error rate came way down, because now, some of the stuff was supported. But yeah, a lot, of course, documentation is always a factor. So, but yeah, they just don't sometimes understand what they're looking at and what they're getting.
Exactly. That's always what the difficult part is, right? When they receive these copious amounts of mails from the CMS, right? It's kind of a yucky feeling, and I do think that's why a lot of times the people on the provider or the practices team is also wary of opening those pieces of mail in a timely fashion. I agree with you. I've had many a instance where I've been called in late in the game, right? That doesn't set anybody up for success if we're being called in late in the game. Because like you had mentioned, and like these links tell you, you have a very short time frame to get things together. It's 45 days where you have to send things back. You have to respond, right? So yeah, a really, really critical detail that people who are on your team at the entity need to be aware and be able to handle and escalate these types of issues timely. That's so important. So we have another link here to share with the audience, another kind of a one-page info sheet on the TPE program that CMS has put out. So again, basic, great information just to help you highlight and understand what to expect in this process.
Yeah,
And
CMS does a good job of
they,
putting out. I mean, back in the day, they were a little more cloak and dagger about their stuff,
right.
but these days, they've got stuff all over about their programs and what's going on. So you just have to know where to find it or know people that can
Mhm.
help you, like us, watching
Yes,
compliance capers to where
that's
we're
right.
always putting out links for different things to where you're not
Always.
searching all over trying to find stuff. But it's all out there now. So it's not like they're starting these things in secret and nobody understands what they are. You should have somebody at the practice that is, looking at these kinds of things to making sure that, everything's on the up and up.
Mhm.
In the practice itself. And I think some we had talked about too. I think that for a practice, an organization, a clinic, they really need to have ahead of the game because these things are going on all over the place. They've got all kind of different programs, and there's RACs, there's MACs, there's the ZPICs, there's the UPICs, there's the Mafuku, there's the
Mhm.
I mean, everybody's looking for something, and that's just federally. You're not even talking about commercial stuff. So
Right.
in your practice, clinic, organization, whatever, y'all should have a protocol set for
Mhm.
any time a letter from anybody comes
Yep.
in and requests records from you, because it might be somebody for risk adjustment where they're actually just looking for an HCC stuff for that has nothing to do with you.
Nothing.
That's more for the insurance payor, but you don't know unless you have somebody that understands all those different kinds of letters that come in, so I think there needs to be straight protocols down for looking at these kind of things so you don't get behind the eight ball.
That's right. That's a great pro tip that we cannot emphasize enough. Fantastic pro tip. You need people who know what they're doing and how they can help isolate each and every piece of CMS mailing that you receive so it's handled appropriately. So it goes forward to the right set of people in a timely fashion. Absolutely. Because you don't want to get caught missing these very important
Yes.
deadlines. Yeah,
Yes.
we've stressed that time and time again here on Compliance Capers. Um, CMS also has done a great job throughout their website for multiple FAQs. They've done one as well for the TPE program. So multiple people have reached out and they've compiled all of their questions and provided answers. So please take the time to review this as well,
Mm-hmm.
because they have a lot of questions that you could be asking and it's already been answered and it's provided on this webpage. So, it's really important that you have trusted consultants, trusted compliance professionals on your team that you can go to in a minute to ask for a quick advice. Because even if they can't answer it, they know where to send you off to. We really do have a large group of people, trusted people that we can send you off to as well, especially when and if you ever do need a trusted healthcare attorney in many of these types of TPEs. That may be a request that you have as well. And I know you and I know plenty throughout the country that can easily assist you in winning your TPE audit again in round one, in round two, or round three. It doesn't matter. You just need to win. That is
Yeah.
the key. Because, of course, all of these TPEs are governed and found in the CMS Program Integrity
Yep.
Manual. I've put up the link here in Chapter 3. And so, the MACs have to follow what is written here in this Chapter 3 for the TPE audit process. So also take the time or have people on your team take the time to understand what is expected of this larger TPE program, all of the multiple steps that are involved, when that nurse review can get in there and help schedule you time for your education. And again, it's wonderful when you make the time to receive it via a slide deck. It's really, really comprehensive, again, for those service lines. But again, if you happen to be a outlier type of provider, you don't have access to the internet, perhaps, they're always happy to provide you with a telephonic conversation. That education can be received that way as well, directly from that nurse reviewer at the MAC. So keep that in mind as well, as they're aware of everyone's multiple situations. So don't feel like if you do happen to be one of those smaller practices or somebody who's outside of the Wi-Fi towers. We have lots of people in our country who still don't have broadband access, and CMS is well aware of those types of people. They're well aware of it, and they will make it a point to make sure that you receive that very necessary education via a telephone situation. And again, it can be with the provider directly, obviously, as well as his or her appointed consultant or his or her appointed attorney. It's just a matter of what is worked out, pursuant to the details on the letter that you receive, and then communications back and forth that will then help emphasize who you want there with you. So it's all very, very wonderful. I really embrace the entire TPE program. I think it's wonderful. All of the various MACs throughout the country as of 2024, we'll get into this next week. But there are, over 10 or more that are actively being looked at, TPEs, on the various MAC web pages specific to TPEs. So, there's a lot of hot button services that are under these types of TPE audits. So I think it's just a matter of time before someone in our audience and their team is going to be receiving a TPE audit. And again, it's nothing to be afraid of, because if you take action swiftly and you address what needs to be addressed, you are able to confidently pass during round 1, round 2, and round 3, in my opinion, so long you're hungry to receive those positive results.
Yeah, like we've said, no longer is it like an if it's going to happen. It's more like when it's going to happen. So you really need to take preparations in the practice for it. The only other point I wanted to make was, once you pass, don't forget, in a year, they will check on this stuff again. So whatever audits you do, whatever your internal audit schedule is, whatever you got on that TPE for in the first place, that needs to be added to your audits, because you need to be checking on it every quarter, every 6 months, to make sure that everybody's staying in line, because they're going to look at it again. So you don't want to like, oh, we did great, we passed, we got out of it, and in a year they send you the request, and then all of a sudden they're coming back to you saying, all right, like, what happened, buddy? Because then that's showing just blatant disregard for what they tried to help you with. So that can make it a lot worse. The fact that they tried to help you, you took it, you said you were good, and then you just went right back to doing whatever you felt like doing, is kind of how they take it. So make sure whatever you went under TPE for, you keep a check on it to make sure you're staying good, because they will check back on you and make sure that it's staying right.
That's a great reminder. Great pro tip, that when you successfully pass your TPE, best practice recommendation is to document that in your compliance program. I passed my TPE on this service line. These are my next best practice steps to remain in compliance forever and ever. Amen. Right? To not go back to old habits. Right? So it's best if you document that education that you received and that you embraced, and you're going to continue embracing, because when you are spot checking and continuing your internal auditing function, which we love, right, that practices start doing, that type of internal audit should pass with flying colors, because you've documented in your compliance program that you've taken this education, you've embraced it, and now you're going to follow it through again and again and again. So when the MAC comes back in 1 year, like you stated, on 1 year and 1 day, they have nothing to question you for. If they ask you again for a handful of records, you will pass easily that time on round one, right? Because you've been compliant, you've embraced that education earlier. So yeah, that's a great, great pro tip there at the end, Betty. That's fantastic. Yeah, love it.
They're watching, always watching.
They're watching. They are always watching. And like we've always said, they have access to those claims, right? And so it's that volume of a certain service line that will put you at risk as either an outlier or as a risk for the highest service line or that particular surgery, whatever is on them. Some new service, some new technology. There's all sorts of things that they already have a handle on because it's the CMS, and they've been doing this for a very long time, analyzing those claims, those data analytics they have at their fingertips, and they've been using the analytics swimmingly, in my opinion, for all of this time. And that's why they can quickly send you these types of mailings, because they've highlighted you as high risk to the Medicare Trust Fund. Again, the greater overarching rationale of why these TPE audits actually exist. But yeah, I thought today's episode on the background details was pretty robust. We went through a lot. I know there's so much more that you and I could talk about, but we just wanted to give our audience a taste of what the TPE audit program is all about, and the fact that it is complex. And you really need to pay attention to each and every piece of CMS mailing that comes out regarding the TPE process. Because as we've stressed here, there will be multiple pieces of mail that come to you in the TPE audit. So, yeah. Any last final words, my friend?
No, just stay compliant. Be audit. Always, be looking at your stuff because you don't want to get into the TPE situation in the first place. So if you're, doing audits and education regularly inside, I mean, there's no for sure thing, but if you're always looking at things and making sure you're staying on top of stuff, you're less likely to get pulled for these things. So, the whole preventive, you don't want to get sick. You want to prevent from getting sick. Well, we don't want to get audited. We want to prevent from getting audited. So we need to do these internal reviews.
That's right. Preventive measures in the business side of medicine as well. I love it. I love it, my friend. Well, I can't wait for our next episode next week, where we're going to be highlighting a specific TPE that's going on in a specific MAC jurisdiction. I can't wait for next week's session, where we get into the nitty-gritty, the specifics of a TPE audit that's currently going on. So, I can't wait to see you next week, my friend. This was a great episode. Loved it.
Yes. Thank you. And thanks y'all for all, listening to us. And I hope you're taking our stuff to heart. So thanks.
That's right. Thanks, everybody. Bye.